Hello everyone, welcome to the MOOC lecture series, an initiative taken by LG Institute of Pharmacy. Myself, Tosha Pandya, Assistant Professor, Department of Pharmaceutical Technology, will be taking a session on emulsions. So one of the polyphasic dosage form which we have seen was the suspension. So let us see the next polyphasic dosage form, that is emulsion. So what is the major difference between suspension and emulsion? In suspension, you have solid particles dispersed in the liquid phase, whereas here in the emulsions you have two immiscible liquid phases. So one of the liquid is dispersed as droplets in the another liquid phase. So it may be oil in water emulsion or a water in oil emulsion. So first of all, how do you define emulsion? So emulsion is the thermodynamically unstable system which consists of at least two immiscible liquid phases, one of which is dispersed as globules in the other liquid phase and is stabilized by a presence of an emulsifying agent. So here you can see the diagram of the emulsion in which you can see the globules which are dispersed in the external phase. So what are the advantages of the emulsions? So here the major advantage of the emulsion is that you can solubilize both the drugs, hydrophilic or hydrophobic, in a single formulation. So they are used to deliver the drug with low aqueous solubility and oils with the therapeutic activity. It is easy for patients having difficulty to swallow because here you have liquid dosage form, both are the liquid phases. The irritant effect of many of the drugs can be reduced by entrapping it in the inner phase. Next, the taste masking is possible, as you know, if you have a liquid dosage form, always by adding a sweetening or flavoring agent, you can reduce the bitter taste of a main drug. Along with the advantages, as you know, I mentioned in the definition, it is thermodynamically unstable system. So the major disadvantage is that it is thermodynamically unstable because you have liquid phase and the globules are there, which is leading to instability. Moreover, it is difficult to manufacture. To keep the two liquid phases in one phase is a challenge. So let us see the classification of the emulsions. As you can see, you have oil in water emulsion in which the oil globules are dispersed in the water phase, and you have the water in oil emulsion, as you can see, in which the water phase is the inner phase which is dispersed in the outer oil phase. Next, you have also the multiple emulsions. So in what is the multiple emulsions? You have three phases here. You have water in oil in water emulsion, and you have oil in water in oil emulsion. Okay, so these are mainly used for peptide drugs which are leading to which will leak out in the outer external phase. So you are protecting the peptide drug by giving it a three-phase system. So now these are the identification test of the emulsions, like the dye test, the dilution test, the fluorescence test, the cobalt chloride test, and the conductivity test. So now how are these tests? These are tests used to identify whether you have an oily water emulsion or a water in oil emulsion. So in the dye test, if you are adding a oil soluble dye or a water soluble dye, it will be soluble in the respective phase and it will give the color in that phase only. So if the majority is the water phase, the color you have, it will show the color. If you add a water soluble dye, you can identify it as a oil in water emulsion. Similarly, dilution test, whichever external diluent you are adding in higher amount, you will get the separation of phases in that way. Okay, and even in the conductivity test, if you have the water in the major amount, it will give the conduction, as water is a conductor of electricity. Now the additives of the emulsions, major additives are the emulsifying agents, the auxiliary emulsifiers, antimicrobial preservatives, because you have the water phase which is there, which is prone to microbial attack, and you have the antioxidants to prevent the oxidation of the drug. Now classification of the emulsifying agents. So majorly you have the three categories of the emulsifying agents. First is the surface active agents, which will form the monomolecular film. Monomolecular film means it will form only a one layer film. So the examples of the surface active agents, you have different categories of surface active agents. It may be cationic, anionic or non-ionic. The least irritant are the non-ionic surfactants, like the twin 80, span 80, okay, SLS. These are the some of the surface active agents which are used for forming a monomolecular film. Next, the hydrophilic colloids. Now, these colloids like the gum, acacia, gelatin, tragacan, they will form a multimolecular film and protect the emulsion by forming a film at the interface. And then you have the finely divided solid, which will form a particulate film like bentonite, aluminum oxide. These are some of the finely divided solid particles which will form a particulate film. So depending on the type of the film formed, you can see here you have different emulsifying agents used. Now the physical instability. Now this physical instability emulsion, as we discussed, it is a highly unstable system. So what are the types of the instability the emulsion is facing? So you have flocculation, creaming, coalescence, and the phase inversion. So first let us see diagrammatically the instability of the emulsion. So this in the middle, as you can see, it is a good emulsion, okay, in which you have the globules dispersed in the outer aqueous phase. As you can see on your right hand side, the second number, that is the flocculation, that is the initial instability of the emulsion, in which the small globules will aggregate and form the floccules. Okay, now the second instability, as you can see, it is the creaming. Okay, we are going in a order in which the instability occurs. So as you can see, the third number instead is creaming, that is creaming in which the two different phases are formed. The globules will accumulate upward or downward. So you have upward creaming as in case of oil water emulsion, and downward creaming as in case of water in oil emulsion. Now this creaming is the initial cause of the first instability, as you can see, that is the coalescence. Okay, the creaming will lead to coalescence, and that is highly undesirable in the emulsion, because large aggregates of the globules will be formed, okay, which is not aesthetically preferred. And then is the breaking, as you can see, you have completely two different phases formed, which is highly not preferred in the immersion. Now, phase inversion is mainly that if you have formed an oil in water immersion, it will lead to water in oil immersion. Now, all this instability can be prevented if you choose a proper emulsifying agent. Okay, and proper balance should be chosen of the emulsifying agent. So, the different factors which can be controlled to avoid the instability are the particle size, the charge, and the viscosity. If you control all these factors, I think you will get a proper emulsion. And the surfactant should be chosen according to the HLB value, that is the hydrophilic lipophilic balance. You have the surfactants which are, if you are preparing oil in water emulsion, obviously you will choose a emulsifier which is soluble in the water phase. So whichever is your majority of the phase, that according to that you will select the emulsifying agent. Now the general types of pharmaceutical emulsions, as you can see, you have lotions, liniments, creams, ointments, vitamin drops, etc. So again, for the emulsions, specific labeling condition is shake well before use. So I hope you are clear with this session. Thank you very much.
Please do like, share, and subscribe our YouTube channel Pharma Ignite, and do not forget to press the bell icon to get the regular notifications so that you do not miss out any of the topics in this chapter. Thank you.